Good afternoon, everybody. My name's Gavin Morgan. I'm a social worker and regional engagement lead with Social Work England. Thank you very much for joining us for this session. Is specifically going to be looking at social work supervision, and I will introduce you to our speakers shortly. But as we move to the next slide, there's a legal disclaimer here, which please just take a moment to absorb this information. But in short, it's any views and information or opinions expressed by third parties during Social Work Week are the speaker's own, and they don't necessarily reflect the views of Social Work England or its employees. We haven't endorsed third-party content, and we don't expect liability for the content of sector-led sessions held during the week. And as I move on to the next slide, your privacy is very important to us. You provide us with personal information such as your name and email addresses. That information will only be used for the purpose it's been collected, and we'll retain it for a period of time in accordance with our data retention schedule. And you can see here that there's a link which gives you the full details if you're interested in finding out more about that. We are going to be using Menti during this session. That is an option. That's a way of us getting some feedback through polling and other clever means of gathering information. So if you've got a smartphone handy, do use that, or a device which you can access the internet on separately to your computers, then that would be helpful. So just bear that in mind, and I'll now hand over to Jackie. Jackie.
Thank you, Gavin. Good afternoon, everybody. My name is Jackie Sweeney, and I'm the Principal Social Worker for Adults at Warrington Borough Council. And hopefully you're all here for a session around social work supervision and ensuring best practice through embedding our standards and values. Could I have the next slide, please? Okay, so without further ado, I'd like to introduce my colleagues. So we're all part of a team here who've been involved in this project around practice supervision. So I'm going to call everybody by first name, and then you can introduce yourselves. I'll work on the basis of what I can see on my screen. So first of all, Becky.
Hi everyone, good afternoon. I'm Becky Brown. I'm team manager of the quality assurance team in Children's Services in Warrington.
Thanks, Becky. And Nicola?
Hi everyone, I'm Nicola Whiteside. I am the partnership manager for the Cheshire Merseyside Social Work Teaching Partnership.
Thanks, Nicola. And Tom?
Hello, I'm a professional and workforce development officer in Warrington Borough Council in Adult Services.
And you've already met Gavin, so I won't introduce him again. Okay, could I have the next slide, please? Okay, so just a very quick overview of the session. So over the next hour, we're hoping to share some of our learning and some of the recommendations that came out of a piece of research that our regional teaching partnership undertook. We're going to start the session with a quick reminder about social work professional standards, and then go into a little bit more detail about the National Practice Supervisor Standards, how they came about and what they are. And then we'll tell you a bit more about the research we did in Cheshire and Merseyside, sharing a couple of case studies which really highlight the difference in approaches that different local authority employers have taken to implementing the practice supervisor standards. And then following on from this, we'll share our thoughts, our findings and our recommendations for further embedding those practice supervisor standards before hopefully opening it up to you for any questions, thoughts and reflections that you might have. Okay, can I have the next slide, please?
And I think that's over to me. Is that right, Jackie?
It is. Sorry, Gavin. Should have said over to Gavin.
That's okay. So yeah, what we'd like everybody to think about during the session is well, what I'm going to ask everybody to do is think about the professional standards set by Social Work England. Remember, these standards are the standards which all social workers in England are required to work to and adhere to. They were created with the sector, and remember what these standards are about. We never want these standards to be a tick box exercise. They're about being safe. They're about promoting the rights of individuals and communities. They're about being accountable for, and acting with professional integrity. They're also about being ethical and reporting concerns as and when we see them. And of course, how could we not mention maintaining our continuous professional development? And what I'm going to personally say to everybody today who's watching this session is reflect on how these standards apply to what you hear from our speakers, and do think particularly about the supervision you receive, or perhaps the supervision you provide, which is provided within organisations, and think how you're going to embed the learning in terms of your supervision, whether you're receiving it or delivering it, or both. And I'll pass on to for the next slide.
Okay, and I think it's back to me. So this is where we're going to see if Mentimeter works. So in the spirit of partnership and co-production, at various points during the workshop, we're hoping to get you involved by sharing your own views and experiences. So this is a little bit of an experiment for us as well, and hopefully it will work. Hopefully a lot of you on the call are already comfortable with using an app like Mentimeter, but for those of you who aren't quite sure how to use it, I'm going to try and do a quick explainer. I'm not the most technical of people, so I'll do my best. So if you're watching through a Teams account, then I believe you should be able to find Mentimeter by clicking on the Menti tab at the top of your screen. Is that right, Gavin? I think it is. And entering the code that we've given you in a box on the right hand side of the screen. But just a word of warning, when we tested this out using the Menti app in Teams, we did notice that you have to scroll right down to the bottom of the screen on the right hand side to find the right place to put your code in. And I think we might be sharing a screenshot just to show you that as well. So if you're not watching this through Teams and you're watching the workshop through a browser, or if you just can't find the Menti button on your Teams app, you can also open Mentimeter on your phone or computer using the web link we've provided, and then just putting the code in there. And it looks to me like people are already responding, so lots of you know what to do. So we're, as I said, we're putting a few explainer screenshots in the chat. It's not compulsory, so please don't worry if you can't do it. And obviously, if you're watching this workshop at a later date, then that feature won't be available to you. So I think we're already getting lots of answers here, which I can just see. It's a little bit small for me on my screen, but the question we're asking you is, what level of knowledge and understanding do you think you have of the National Practice Supervisor Standards? Would you rate it as excellent, good, some, a little, or none? And we are going to what I'm not going to do is spend a lot of time kind of analysing the results at this point. This is really just for us to get a flavour right now of where people are at the start of the presentation. And it's interesting for us as well to see whether what you're saying reflects some of the assumptions that we made as a teaching partnership about how aware social work practitioners were of the standards. So it's looking to me that most of you are saying some, and as I say, I've got a very tiny picture on my screen, so it seems to be that the majority are saying some. So and hopefully we will now be able to enlighten you a little bit more, so that by the end it might be a little bit more than some. Okay, if we could have the next slide, please. And this is also me. So just as by way of introduction around the practice supervisor standards, effective and skilled supervision is really important if we want to support social workers to practice in the best way possible to support their resilience and well-being. And good supervision is essential to help our workforce to develop and grow, and to maintain and improve our professional standards. So the National Practice Supervisor Standards were developed a number of years ago to ensure that there was a consistent approach for supervision across social work. When they were launched, the aspiration was that each employer would engage with the standards to ensure that local practice supervision was at a consistent level, and to ensure that every social work employer was equipped to provide quality supervision. So in essence, by using this approach, local employers and partnerships would have a clear pathway or model for practice supervisor development, and a way of monitoring what they were doing to assure themselves that supervision was being delivered to the best practice standards. So these practice supervisor standards have been developed in such a way as to be employer-led. And what that means in practice is that there wasn't an intention or requirement that they should be directly monitored by any national bodies. So what this means at the present time is that it is completely the responsibility of local employers to implement those practice supervisor standards or not. Since the development of the practice supervisor standards, we are aware that a number of different programmes for supervisor development have emerged at a national level. So, for example, there's the Frontline Pathways programme, and more recently, the Department of Health and Social Care Supervisor Development offer. But what we do know is that these programmes aren't mandated, and also they don't necessarily have the reach or availability for everybody to access them. So because we had a sense that the standards hadn't been fully embedded within social work nationally, as a regional teaching partnership, we decided to undertake a local project to explore how engaged local employers really were with the standards, and hopefully to gain enough learning from that to inform us in relation to what our next steps could be. And if I could have the next slide, please.
Okay, the project was funded by DFE through our teaching partnership. By engaging with a range of stakeholders, supervisors and supervisees, including people with lived experience, as well as other teaching partnerships, we identified what each employer was doing and any good practice that could be shared, including what were the barriers and potential solutions. We aimed to use this insight to help shape the employer's response to these expectations and to identify recommendations. Next slide, please. The project lead undertook scoping interviews with 14 employers from both children and families and adults to identify what was the current situation for practice supervisor development. 2 surveys were devised, one for practice supervisors and one for practice supervisees, to gather their views on approaches taken and any ideas for further development. These were followed up with one-to-one interviews. In addition, we undertook interviews with a number of people with lived experience and representatives from other teaching partnerships. We then collated and analysed the information and produced an overview of where we were as a region with practice supervisor development, including recommendations both nationally and regionally. Next slide, please.
And this is the first of a couple of case studies we've got to share with you here. We took a number of case studies from some of the outcomes, some of the data within the project. The first one here is from Warrington Borough Council, from Adult Social Care Services, where we took a training approach. So what we did was we provided 4 half-day online workshops about 2 years ago now. These in-house learning events were co-facilitated by 2 of our professional workforce development officers, so staff with experience of providing professional social work supervision. Our attendees completed a pre-course self-assessment of their strengths and learning needs against these post-qualifying standards, the practice supervisor standards. The group was made up of 15 senior practitioners or deputy team managers, and they formed our pilot group. So the workshops included reviews of research in practice tools and materials, video analysis, also of sharing personal experiences and challenges of providing supervision. And we asked for people to get involved with action planning as well, to look at how they could embed some of their new learning. So the themed discussions for the sessions, which covered the same ground as the standards themselves. We asked, what does good supervision look like? We covered relationship-based practice, supporting supervisory resilience in practice, facilitating reflection, analysis and decision-making, developing others' practice, gathering and using feedback, audit and recording, and the final theme of the 7 themes were managing performance. So we weren't providing a lengthy supervisor development pathway. We delivered the workshops over 4 consecutive weeks. There weren't any assessed elements. There was no portfolio or mentoring as you'd expect in a larger program that might cover a few months. So it wasn't fully experiential or skills based, but we tried to make it as interactive as possible for online group learning. And we focused on the practicalities of applying knowledge, principles and values in action. And we tried to complement our new manager training offer and the corporate management development program that we already had in place. Evaluation of the sessions were generally positive. Comments included the importance of making time to prepare for supervision for supervisees and for supervisors, and to try and go beyond casework discussions to fully support supervisees' practice and their professional development. Thank you. Next slide, please.
So in Warrington Children's Services, we follow a systemic practice model. So I'm just going to talk briefly about what we currently do to try and promote consistency in the practice standards and that quality across the board. So one of the key things that we offer is a systemic supervisor course. It is a year course through the Centre for Systemic Practice and offers sort of tools, techniques, and methods to be able to offer that quality tailored supervision. Although the course is brilliant, the only sort of constraint to it is sort of similar to what Jackie had mentioned before about it doesn't then happen very often. So we have like one cohort a year because of the sort of, it is a large course and resources. So one of the next steps for us in Children's Services is to actually develop our own sort of in-house condensed version of it. So what we'd be looking at is 4 days, take key elements from that year course to be able to then target more senior practitioners and managers and be able to do that more frequently, to be able to sort of, again, have that consistency and that momentum of embedding those practice standards. So that's what we're going to be doing next. But what we currently offer is a team manager handbook and guide as well. So this is something that we offer and we send out to new managers, whether they're new into our authority or if they've stepped up. And it does cover sort of our reflective supervision, the supervision template, and expectations and tips for managers in supervising. But it's actually been developed in collaboration with our social workers as well. So it's got their perspective around what makes a good manager, what makes good supervision from their perspective. So things like managers asking what they would like to talk about in the supervision. So it's meeting the supervisee's agenda, not just the managers. That's just an example of what we've got in there. So again, the kind of only constraint really is that you can have all these glossy documents and they're great if people read them, which hopefully everyone does. But if not, what we're thinking is, and what we're developing is a one-to-one manager induction. So this would be led by our service managers, so that as soon as we have someone that goes into a management role, they would have a bespoke one-to-one induction early on. So as soon as they start in that, either that career as a manager or a supervisor, so that again, there's that space to talk through the expectations, to show the systemic supervision template, to reflect on the different questioning styles that you can use in supervision, and really try and promote that quality supervision from the very get-go. What that would also enable us to do as well is to promote and encourage practice in what we already do. So at the moment, we have a Warrington toolkit, which is a central space on our intranet for sharing of key resources. So at the moment, we have sections such as flowcharts, good practice examples, and we've now got a practice educator section. So the reason for that being to share those resources, those reflective tools, learning style questionnaires that are really key for good quality supervision and embedding those practice standards. So rather, you often have pockets of people who are really confident and have lots of resources under their belt. And we want to be able to not just have pockets, but share that and have that kind of, consistency. So that's what the toolkit and having that practice educator section enables us to do. But we've also, the last thing that I'm going to share that we do is that we have a practice educator Teams chat. So that, again, we can share any links from places like Research in Practice or webinars. For instance, recently there was a webinar on working with those with neurodiversity that we could then just put the link into the chat. And although I know it's practice educators, it can be for, any supervisors as well, so that we're sharing that learning, and people can also ask if they have any questions, that we can get other perspectives from other supervisors. Next slide, please.
In addition to the employer case studies that you've just heard, we collated information from people with lived experience. And as you can see on the slide, there were several key messages. As a result of this activity, we co-designed 4 resource packs constructed around an individual's lived experience and the key messages they wish to pass to our social workers and their supervisors. This enabled us to provide tools for use within supervision and to support supervisors to challenge, support and develop social workers in practice. Next slide, please. From other teaching partnerships, we found that there was variation in terms of approach to the practice supervisor standards, with some employers collaborating across the region, some managing as individual organisations, and some trialling approaches amongst a small group of employers. As noted locally, the approaches were either built around policy or training. Overall, there did appear to be an appetite in working collaboratively to explore portable training and accreditation packages. Next slide, please.
And findings from the employers, the 14 different services who are involved in this research. 3 of the 14 services we found out weren't really actively using some of the available national resources, but the majority, 11, were, and fairly consistency. There were some inconsistencies though about exactly how they were being used. For example, 3 of them were delivering online materials and had developed a train the trainer offer around some of the national resources, for example, that Research in Practice have provided. 7 of the employers reported nationally commissioned training programs that they were using, and 3 employers were promoting self-directed learning through online resources. None of the frameworks from the employers that they reported on were combining adults and children supervisors, though, and none of the employers had found or developed a clear process for accrediting their program. None of the employers either identified an established model for practice supervisor development that had a robust quality assurance process, which would be important for looking at quality and looking at impact as well. Although 3 employers did have a framework in place that they felt with further development could become a trusted, structured model across their organisation that they could properly quality assure. Where an approach had been identified by employer, some focused specifically on social work supervision development, while others were more broad and focusing more generally on developing corporate management skills, but we included them as well because there's a large overlap. Employers did let us know, though, they had some concerns about developing programs and delivering them, and a lot of that was down to limitations in local capacity and finding the expertise really for local program delivery. There are, of course, competing demands on supervisors' time, so exactly how much time you dedicate to this has to be balanced. And the practice supervisor standards, some employers found that they were competing with other policy developments for prioritisation as well. So investing time in this was tricky for some. There are a large number of resources there that you can use, and we'll make sure we post some of those in the chat. But there's still really no clear map of how to use them really, and how to develop them into a clear CPD program for supervisors. The majority of employers, though, in the surveys identified that a certified or accredited program would offer credibility and signal the value of supervision to practitioners and to supervisors. And next slide, please.
Okay, just before I carry on with our regional and national recommendations, just to let people know that there is a Q&A function as well in Teams, and if anybody does have any questions for us at the end, please do put your questions in. I do think we're going to have time to look at some questions or comments or thoughts about what you're doing locally on supervision as well. So just in terms of what came out of our piece of research for in terms of regional and national recommendations, there was a really rich discussion in the interviews that we had with local authorities, with other areas and people with lived experience, and loads of suggestions about how we might take further action to improve and strengthen our practice supervisor training offer, and from that more effectively embed the national practice supervisor standards. So from a regional point of view, our local employers were really reflected on the existing supervisor training model that was already offered by our teaching partnership, giving, and were fairly, gave a critique, both positive and negative, about the benefits of it, and measuring that against various local approaches to practice supervisor development that were taking place in individual local authorities. I mean, as you can see from our two case examples, both of them from Warrington, one from children's, one from adults, each of us is taking quite a different approach to practice supervisor standards. So if you replicate that across all the local authorities in our own region and then across the country, I'm sure there are many different approaches and ideas about how to do practice supervision in the best way. Several of the participants in the study thought that it would be useful to consider developing a regional supervisor development programme through the teaching partnership, which was based around those national practice supervisor standards, and that was kind of irrespective of what might happen or not happen nationally. Another suggestion was the development of a virtual network of local practice supervision leads. So these would ideally be senior social workers in each organisation, whose role would be to promote standards of practice in supervision, share best practice, and they would also be able to network and discuss challenges to implementing those practice supervisor standards. Another idea that was suggested by a number of people who took part in the research was that it would be helpful to have a regional model with a shared understanding of practice supervision standards. So that regional model could allow scope for local initiatives and approaches, but would also support a shared understanding of what good looks like in terms of good practice supervision. On the basis of this, the teaching partnership could potentially host some kind of virtual hub of shared resources, tools and best practice ideas, a little bit like the kind of thing that Becky was talking about it, but on a regional level. And finally, because our research highlighted that lack of formal accreditation processes for practice supervisor standards, some people suggested that we needed to explore further what would need to happen both regionally and nationally to develop some kind of accredited programme, perhaps akin to the practice educator qualification, recognising that although there are quite a lot of crossover and similarities in terms of what would be potentially in the practice educator qualification and the practice supervisor qualification, there are also some significant differences as well. So in terms of recommendations for a national level, participants in the study said that they would really value enhanced clarity and feedback from national lead organisations about what are the minimum expectations for employers and how do we consistently implement and monitor those practice supervisor standards, and what support might we get nationally to do that. They also said that they would like to see a long-term consistency in the offer for developing and training social work practice supervisors. So several people who took part in the study said that they would welcome national support for a formally commissioned supervisor development programme. And with this in mind, an ask from the people who took the research was that we took this learning to a wider audience, with a view to, and this is one of the reasons why we brought this session or put this forward to Social Work England today, so that we could open up the discussion and consider what potentially are the options about developing a longer term, sustainable, accredited national practice supervisor programme that could be available and accessible to all social work practice supervisors. Can I have the next slide, please?
So that takes us on to sort of trying to get an understanding from yourselves whether people actually would like a nationally accredited programme for supervisors. So I think some have already started to respond, which is brilliant. So again, we're using the Mentimeter function if people would be happy to respond to this. I think what it could do is add a lot of weight, perhaps one way or the other, to whether there is that appetite there for a nationally accredited programme. Because I think, as Jackie said, there are those differences. You know, there's different courses that different organisations are using. Do we want to explore having one more national one? So far, the results are coming up, and everyone can probably see them as well, but it's looking very heavily in favour of having a nationally accredited programme. And obviously we can't make promises off the back of this, but, you know, we have got Social Work England here, so, you know, no promises, but, you know, I think it does show the appetite and potential demand for a nationally accredited programme. We've got 85 at the moment who are saying they would like one, and 18 a maybe, and just one that wouldn't. So I think that's quite telling and quite powerful. So appreciate everyone's responses to these questions as well. It really helps us with that understanding. We've, you know, just on this subject as well of, you know, your involvement and getting your views, on the next slide, we're sort of towards the end now, but on the next slide, we'd really love to capture some of your thoughts and get your involvement. Again, it's just using the same platform of Mentimeter. But just if we could have people's views on what do your employers currently do to develop practice supervisors? If people could share, it should start coming up as, I think, speech bubbles. And I think, you know, in this kind of forum, it can be really helpful to share and learn from others. Just get your pens and papers ready if there's ideas you want to take back to your own organisations. So I'm going to read some out. They're popping up here. But if you do miss any, don't worry, because this is being recorded, so people will have access to the recording, and also the slides that will have these responses on. So if there's things that you do then want to try with your own organisations. Okay, so in terms of what people are currently doing to develop practice supervisors, we've got peer group supervision. Yeah, that's a really, really useful one. Mentor for new supervisors, great one. Frontline pathway program, yep. So there's still some, you know, people using the programs that are already out there. In-house training and mentoring, access to research and practice tools. And I think that's, you know, research and practice are great, aren't they, with their tools, and it's thinking of how you then share them so that, again, that learning can be spread amongst the workforce. E-learning, again, more sort of in-house training, reflection. So really, really useful responses and feedback that, again, I know that they start coming off the page, but you will get access to all of these to be able to properly look and see what other people are doing that you might want to consider yourself. Some have said they haven't got anything half-day training, then you're on your own. So again, maybe you can take some of these ideas and and try and get them implemented in your own authorities if you're not having too much at the moment. So loads of responses, really appreciate that. We've just got one other question that we'd appreciate some reflection on as well, but some great ideas on there. So just this final one of what alternatives do you think there would be? So most people did say that they would like an accredited training programme, but if that weren't to happen, what alternatives do people think could be used that could improve practice supervision? So any ideas or suggestions would be really great to hear. Practice supervisor development programme, supervising the supervisors, absolutely. So again, that could be your own sort of in-house version, couldn't it? Having a workplace, in-house strategy. Okay, so specific to the organisation. Regional training programme, guidance, supervisor shadowing sessions. I think that's a really good one, because we probably don't, we often will promote and encourage shadowing with our newly qualified social workers, but do we do that with management and supervisory roles? Possibly not as much. Reverse mentoring, love that. Empower your team. A local festival of practice. I'd love to know more about that, but so a lot of great ideas on there. And some to do with teaching partnership and mentoring. So there's this sort of either a program or guidance, and that sort of, it's coming across that sort of mentoring, that again perhaps is a little bit of a gap in terms of supervisors. So really, really helpful. And again, we appreciate your responses. So thank you so much for that. Next slide, please. This is over to Gavin.
Thank you, Rebecca. So this is a point where we can look at some of the questions which have come in. It's timed at the point where the sun's really shining through my window, but I'm sure I can get through that. But thank you, everybody, for what's been really good presentations so far. And I will just tell everybody who's in the in the room just to take note of what I've put in the chat, which is some feedback. So between now and well, at some point, if you could complete that, that would be great. Now, we have had some questions which have come in, which I'll put to you all now. And we've got a little bit of time, so feel free to put some more questions through. I will address the first question myself, which is will slides be available? Absolutely. But the question really to the panel is how do the how do the PSSs work together with the PEPs? That's the practice educator professional standards for practice educators. Do we have any thoughts about that?
I could start to try. I might defer to my learned colleagues in a minute, but I think that there's from my experience there's some crossover, but I think what we don't always recognize the distinctions as well. So that practice education is talking about taking somebody through their that going from not a non-qualified practitioner to a qualified practitioner. There's a large focus on the assessment role in particular, and there's a focus on working with that person in collaboration with the higher education institution to ensure that they're meeting their competencies, and then making a decision about whether or not they are actually competent to practice as a qualified social worker. And I think that there is a differentiation there between what a practice educator is doing and then what a practice supervisor is doing, which is working with potentially with qualified staff, also possibly with non-qualified staff, but with qualified social workers who potentially are already should already have a level of competence in practice. They may be working at experienced social worker level themselves, for instance, and so that potentially raises a different set of issues and questions. And I guess then for supervisors, they have to be thinking, they're thinking less about that assessment and get help, working with somebody as to whether or not they're going to pass or fail something, or and more about how are we working to improve somebody's practice, potentially dealing with fitness practice issues as well, and coaching, mentoring, those sorts of skills become increasingly important. I don't know if Tom or Nicola or Rebecca have got any other thoughts on that at all.
I could add to that, Jackie. Yeah, the practice educator professional standards. I suppose, as you've explained, do something different to the practice supervisor standards, because supervision is just one element in the PEPs. Educators, they've also got to show, develop skills in facilitating learning, in assessing practice, and promoting continuous professional development. And practice educator programs are either led, by, again, they're not national program, they're led either by employers or by universities, and are generic, whereas the practice supervisor standards are either focus on supporting adults or children's. So there's a distinction between what they're used for, even though some of the content and the skills are shared, if that makes sense.
And there's actually another question which perhaps follows on from that, Tom, but I don't want to sort of interrupt anyone else's flow if anyone else had a thing to add to that. Well, I'm going to put this other question to you now then, which is a question about why are the supervision standards different for adults and children? For example, relationship supervision is considered a standard for one, but not the but the other. Any thoughts on that?
I'll have a go again. My short answer would be I don't know, because these practice supervisor standards have been developed at a national level, haven't they? But I guess it's because we have, I think, culturally and organisationally, we have become quite separate in terms of the way we work. Certainly, I can only speak for how we're working in Warrington, and we are taking steps to work more closely together, I would say. Having said that, we certainly have different practice models. So in children's services, as Becky described, they're using the systemic model of practice. In adult social work, we're focusing on a strengths-based approach, and that's probably more of our practice model. However, there is actually, when you look at those practice models, and when you talk about relationship-based practice, there is so much overlap. That's probably the reason why I said I don't know, because actually we could probably look at what's the same and see that mostly there is an awful lot that is the same. It's obviously we're working with different groups of people, but ultimately we all have the same training at the start, so it doesn't totally make sense that they're completely are different standards. I guess also it's where that where the driver comes from, because in adults we're often getting our leadership more from Department of Health and Social Care, Children's Services more from DFE, but that doesn't necessarily mean that it's we're also working together on lots of things. I don't know if Becky, if you'd like to comment on that from a children's perspective.
Pretty much the same, where I don't know why that was, there was those differences initially, and that's what we've kind of always just then gone with, really, from our own sort of parts of the service. But it'd be interesting to look into that to see where that initiated. But just going back to the previous question, because I know you were saying about the flow, but just I think the key difference as well with the practice educator and the practice supervisor standards is that there is probably a lot more monitoring, and people have mentioned mentoring in those reflections, that you probably don't get as much when you're supervising those that aren't a student coming through, or perhaps a newly qualified social worker. So there's not as much sort of structure and scrutiny, if you like, that there is in the practice educator, where people will often get a mentor when they're in training, and there is that sort of more scrutiny around supervising those who are students or newly qualified social workers. So the practice supervisor standards are sort of aimed at trying to encourage that in a less structured environment, which is the supervision of, like Jackie mentioned, those experienced workers, that sometimes can be that gap, because you still need the same scrutiny, and you still need to promote the same development that sometimes can fall through the gaps a little bit because someone's already experienced and classed as qualified. So it's ensuring that doesn't it doesn't get missed, basically.
I'm just going to move on to the next question. Thank you for that. And I think again, there's partially an overlap with some of the things that have been said already, but someone's asking about whether this can be transferred to social workers working in health, and I think that's acknowledging sometimes that divide that we see amongst social workers working in, say, local authorities, the private sector, and health. So, any thoughts on that?
My answer would be absolutely yes. You know, all qualified social workers, regardless of who their employer is, should be receiving you know, a level of professional supervision. As a principal social worker, I was reminded last year at the ADAS conference that we are responsible for all social workers in our local area and not just the ones employed by our local authority. And I think that's quite an important point to make, is that, you know, whether you're working for a local voluntary sector organisation or what you're working for a health organisation, that you should still be able to access a quality level of support, that you'll still have questions about your own practice, if you like that. You know, I think perhaps our colleagues in allied health profession sometimes do that a little bit better in terms of distinguishing that sort of clinical supervision as opposed to, you know, the sort of the task orientated functional supervision. And I think we need to recognise that often those people in those settings need more, not less of it. So I don't know how. You know, again, is it an offer that perhaps as local authorities, where we do have more infrastructure, we should be offering to some of our local partner agencies? I do know some larger health organisations in our area. We've got Merseyside who may have those resources to support their colleagues, but for many of those organisations, it might be about us developing some kind of collaborative relationship in order to provide, if you like, that clinical, I don't like using the word clinical, but I'm just thinking, you know, the professional supervision element as opposed to that kind of functional organisational supervision that you get.
Thank you, Jackie. So we have another question here, and it's someone's asking the question about if there's any information on how you support neurodiversity and supervision, presumably recognizing it. I'm wondering if you have any examples or if there's anything specific that you can comment on in relation to that.
I think, sorry, if you were going to go first, Jackie. One of the things that we're encouraging the use of in children's at the moment is wellbeing action plans, where it's about sort of what are your specific individual needs that we need to take into account. And so that's just that opportunity. It's not as formal as it sounds. We adapt it, and it's basically just that space for, we use it a lot with our newly qualified social workers, that if they just to be able to help us to make sure that we're tailoring our support and our supervision to that individual, whatever their sort of needs look like. And also I'd kind of mentioned before that I do think research and practice have some great resources. So literally, I think it was last week, I had done a training session on working with those with neurodiversity. So they have also got the resources, even if you've missed the training or webinars, on their website for those who obviously have access to it, to research and practice or anything similar. So I would say, you know, drawing upon the resources that are out there, any of those training webinars that you can then watch back, and then, you know, sharing in team meetings and promoting in that way, or if people we have staff engagement, which is a place where we all come together in children's services, have guest speakers, share learning. So, you know, we'd have someone that would maybe do a section on your neurodiversity in that sort of a setting as well. Don't know if anyone else has got anything to add.
I think just to add to what Becky's saying, we don't have any specific tools, but I know that in adults we have used, for instance, building on things like strengths-based approaches and person-centered approaches, some of the person-centered planning tools are really, really helpful, not just for working with the people, the people who use our services, but also with staff. So something like doing a one-page profile with somebody in a supervision session, you can really get to find out more about what works for an individual. I don't think we're there yet when it comes to neurodiversity, as I don't think we're there yet around other areas such as people, any kind of protected characteristics, discrimination. I know that research and practice have developed a tool around anti-racist supervision, and again I think we need to really revisit and look at all of those toolkits and think about, well, how are we really using them in practice? So I think it's still a work in progress, and certainly as more and more adults are being diagnosed in later life as well. So we're some way forward in terms of the people we work with, the people who receive services from us, people with lived experience. But I think in terms of our workforce, we have quite a way to go.
One of the things that people can use that they might have heard of is Honey and Mumford. Let me just double check that I'm saying that right. Honey and Mumford learning style questionnaire, if people just wanted sort of one example, which is a really good tool to use during supervision to again be able to make sure that we are supporting individual learning style as well. So doing that as early on in the process and supervisory relationship as possible is really effective, and obviously then reviewing that.
Thank you so much for that. I think we do have a number of questions that which we're not going to be able to get around to purely because of time. I think it just shows how much there is in terms of the subject to look at. I think one thing I'll leave with you is it's not so much to answer now, but it's a question to think about is how we'd ensure any program for accreditation would look. What would something good look like? And obviously that's one of those questions which you could probably spend all day on examining, but it's something perhaps for everybody to think about. I'm going to just ask for the next slide now, but just before I do that, just as I do that, I'm going to thank you very much for that. It's been a really good session, and but I think it's just important. I'm going to ask everyone to think about this particular standard of our professional standards. This is all to do with continuing professional development, and it's very relevant to what we've been talking about. And just do reflect on this, which is all broken down here. We should always be thinking about how we continually improve and refine our practice. Remember, we never stop learning, and it's all we have to think about how our learning needs to reflect the changing issues that are happening in society at any one time. And remember, of course, supervision is one of the most important opportunities to continually professional development. It's not just about the training you attend, it's about how you do that all important CPD. So remember, if you're going to use this as an example of your continuing professional development, always remember to reflect on these 3 points, which is how have you improved as a practitioner, how are you going to use it to improve the delivery of social work, and most importantly, how will it make a positive difference for the people who are on the receiving end of social work services. And that brings us really to the end of this session. I'm just going to sort of say thank you again to our speakers for a really good session. It's been really great to be part of it today. Thank you. Remember, we have a number of other sessions happening this week. And you can find out more about those on our website, and the slide that you have here gives some more details about how to find out more about that. But once again, I'm going to turn to our speakers now and say thank you so much for your presentations today, and we hope we'll see you all again soon. Thank you.